Well, every day, more than 130 Americans die from an opioid overdose. But the American Medical Association says that one state is tackling the epidemic better than any other. That state, Ohio. So what is their secret? Here to share is Ohio judge from Stark County, Frank Forchione. Thank you so much for joining us this morning. We certainly appreciate it.
Thank you for having me here, and I hope you're staying very warm.
Yeah, it is a cold one out there. But let's take a look at some of these numbers, and let's talk about what Ohio is doing right, specifically Stark County. Ohio, it is the second in the nation in opioid overdose deaths, but there's been a 21% decrease in opioid overdose deaths in Ohio, specifically in Stark County. Those overdose deaths are down for a second year in a row, I understand. So what is it that you're doing differently?
We're doing several things. Number one, we're using what's called Narcan. It's kind of a nasal spray, but it reverses the effects of the opioid overdose. And we have them with all the police departments, libraries, fast food places, where a lot of people go to use. Second thing that we're doing is using a drug called Vivitrol, which is an injection that blocks the cravings. And we've tried some pilot programs. And the last thing we're doing is working with public schools and private sectors. We had a billboard contest with students of Stark County and letting them create the themes so they'll be posted throughout the community.
So another thing that you're doing, I understand that Stark County government agencies have joined with other forces within Ohio communities, and you're suing the biggest pharmaceutical drug makers as well to hold them accountable for the crisis.
Yeah, we're involved in a federal lawsuit right now that's in Cleveland that is expected to have hundreds of people. We're hoping that that case could get settled, and then we could use those funds locally to get more treatment in beds, because we have to get more treatments and save more lives.
Yeah, and I also read a piece that you wrote that talked about this, lock them up and throw away the key type attitude that a lot of communities tend to have, but you're doing something different in Stark County. As you were just saying, it's more about treatment.
Yeah, this is affecting a number of families. The lock them up days and throw away the key is over with. We need to get more treatments, more beds. We need to get people to talk about it. I always say 15 minutes can save a life. We all need to talk to our friends, coworkers, and family members around the dangers of opioids. You
know, we just heard the First Lady. She's out there on at least a 3-state tour right now. That's one of the issues that she's trying to tackle. When we talk about the statistics, you just mentioned the families that are involved in this. It's more than just statistics. And you have this campaign. It's 15 minutes can save a life. Explain that a little bit.
Well, a lot of people are afraid to talk about it because there's a negative stigma. But we've tried to hold symposiums free to the public here in Stark County and just get everybody to talk about it. And the more we talk about it, the more we will look to our friends, family members, coworkers, and get them to take a look at their lives, get them away from these opioids, and try to save each other's lives.
Yeah, and you're completely right when you say, we cannot arrest our way out of this national health crisis. I think more people need to pay attention to that. Thank you so much for joining us. We appreciate your time this morning.
Thank you for having me.
All right, important topic.